Hey everybody, Amanda again. This is my second video where I will discuss kidney disease in the Bracco and how we can test for it. So I want to start by saying what we actually know about kidney disease in the Bracco. It's very limited. It does seem that the filter portion of the kidney, or the glomerulus, is affected more often than the tubules, but both can definitely be affected. Most of the information we have is unproven, and no scientific research has been done to look into kidney disease in this breed. So what can we say for sure? The Bracco seems to be at increased risk of kidney disease. It often affects young and middle-aged dogs, but older dogs can definitely be affected by what we presume to be hereditary disease, up to even 10 years of age and older. It appears genetic since it runs in family lines and can affect multiple dogs in a litter. Once a Bracco starts showing symptoms of their kidney disease, it is often rapidly fatal. We have a small amount of preliminary information in the form of kidney biopsies. 8 biopsy reports have been submitted to the Health Foundation and myself for dogs who died of kidney disease. They all appear to be familial or hereditary. The age range is 2 years to 10 years, and the average age is about 6. 5 of these 8 dogs had amyloidosis. Another 2 dogs had a very similar condition, which we don't even have a name for yet. Amyloidosis happens in the kidney when abnormal proteins are deposited in the form of fibrils, or little strings. Amyloidosis is special because those strings are a specific size and can be tested for using a Congo red stain. In the other 2 Bracchi, they had fibrils that did not test positive for Congo red. We are still in the process of getting more information from the International Veterinary Renal Pathology Service at The Ohio State University on those cases. If this is a different type of fibril that is not amyloidosis, but still runs in families, then that will be an extremely rare diagnosis. Confirming that and determining the link between that and amyloidosis will be very important in understanding the kidney disease in this breed. The 8th dog in that series was directly related to dogs with both amyloidosis and the non-amyloid fibrillar disease. I suspect that dog also had a non-amyloid fibril deposition that wasn't detected without advanced diagnostics. We will likely never be able to confirm that. It's just a hunch. Other information we have available is the blood work and urine results from those 8 dogs. All of those dogs were losing protein in their urine. Half of them had an increase in creatinine, called azotemia, on blood work. And 5 of them had low blood proteins, specifically albumin. The prognosis for these dogs is quite grim. 7 of 8 of those dogs became symptomatic for their disease and were euthanized. The median survival time, meaning half of the dogs died before and half lived longer, was about 45 days. The range going anywhere from 10 days out to 16 months. The survival time for chronic kidney disease as a whole is about 11 months. Interestingly enough, the dog that is still alive 9 months after diagnosis and the longest surviving dog who lived 16 months both had the non-amyloid fibril deposition. It's way too early to know if that disease is less aggressive than amyloidosis, but that may be a possibility. Now that we've talked a little bit about kidney disease in the Bracco, let's talk about how we can test for it. Just as the kidney's function and disease is complicated, so is testing. There is no current test which predicts if your Bracco will develop kidney disease. We can only detect kidney disease once it is relatively advanced. The only almost foolproof test is to examine both kidneys under a microscope after the dog is dead. Even with that, you can miss a diagnosis, and clearly is not very helpful with treatment. So what we can see on basic blood work first would be looking at creatinine. Any creatinine in a dog above 1.4 milligrams per deciliter is abnormal. Sometimes labs will print out a reference range that is higher than that. but I recommend using the 1.4 as your cutoff based off of International Renal Interest Society guidelines. Creatinine reflects tubular function, and 75% of kidney function must be lost before this number increases. Also, because it's mainly affected by the tubules, you can have a dog with the glomerulus portions of their kidney totally destroyed with disease, and they will have a normal creatinine. For example, my boys Lou and Enzo both died of amyloidosis in their glomerulus, and creatinine was normal in both dogs the day they died. Albumin is an important blood protein that we can see on a chemistry analysis, and it might be low when that filter portion of the kidney, the glomerulus, is affected, but not always. And we also have a slightly newer test by IDEXX called SDMA that might be available to you. It is similar to creatinine, but increases earlier in disease. Instead of increasing once 75% of function is lost, SDMA often increases when about 25% of kidney function is lost, which is better, but the kidney still has to be very diseased. This is not a foolproof test, but it may be helpful. But keep in mind that for the dogs with only glomerular disease, it's likely not to be helpful. For diagnosis, we can also look at the urine. High protein levels in the urine may be a sign of kidney disease. There are a lot of other things that can cause protein in the urine, but it's definitely a red flag and should be thoroughly investigated. To test for protein in the urine, your vet can do a simple dipstick test. That test, however, is quite unreliable, but it is a good place to start. The preferred test is a urine protein creatinine ratio, or UPC. A normal UPC is less than 0.5. It can significantly vary day by day, so sometimes pooled samples may be needed. This is a good way to measure protein in the urine and get a specific number to quantify the amount of protein, but like everything, it's not foolproof. The next diagnostic test I will talk about is a kidney biopsy. This is an expensive, invasive test that requires general anesthesia. It can worsen kidney disease, cause significant bleeding, or you might get a non-diagnostic sample. However, it's the only method we have available to look at the kidney at a cellular level. We can look at the kidney on X-ray and on ultrasound, but that doesn't always give us a very good picture. A lot of dogs or Braccos with kidney disease might have kidneys that look normal on ultrasound and X-ray, but actually the dog is dying from kidney disease. So being able to go down and look at those cells is very important to get a diagnosis. And with a kidney biopsy, we can test directly for some diseases, such as amyloid deposition or immune complex diseases. With a good sample, we can prove what kind of disease is present. This can be done when the dog is alive or post-mortem as part of a necropsy or animal autopsy. The tests that should be done on a Bracco kidney biopsy is the normal microscope analysis, a Congo red stain to test for amyloidosis, and also electron microscopy and immunostaining are needed to fully assess these samples. Those are only done at very limited laboratories throughout the country, so I recommend sending all samples to the International Veterinary Renal Pathology Service in Ohio. Without all of those components, it is still possible to miss a diagnosis. For example, 6 years ago, my girl Delaney died from kidney disease. On her initial post-mortem, her kidneys appeared to have one type of disease which is often not hereditary. But when her offspring got sick, I questioned that diagnosis, so I sent tissue to the IVRPS. That's where they found the non-amyloid fibril deposition and are currently doing more testing on her kidney tissue. So it's clear that testing for kidney disease is complicated, as is the disease in the Bracco. So we want a non-invasive, inexpensive, and reliable test. We want to diagnose dogs early in disease and before they are bred. So essentially, what we want is a DNA test. That's still several years away, but we have to start somewhere. In my next video, I will talk to you about research in the breed and how to get involved so we can make that a reality. In the meantime, please email me with any questions. Remember, my email is braccopointer@aol.com. Thank you.